And it's not just hospitals dealing with staffing issues because of the spike in COVID cases. It's also impacting firefighters and paramedics. KCTV5's Leslie Aguilar explains how that could impact you.
Right now, the call volume for emergency medical services is up more than 15% from just a couple months ago. This at a time when staffing at fire departments and EMS agencies is down due to people being out sick or quarantining. It's a huge strain on the system that could impact response times to your next emergency. As ERs across the metro are seeing a spike in patients, first responders are seeing a spike in COVID-related 911 calls.
We're pushing about 18 per day now. And I think our peak about middle of last week was 29, which is the highest in one day we've ever been.
KCFD is busier than ever, and yet running low on manpower with about 160 out sick or quarantining.
We're, strained to get everything out the door and running like we should. And of course, that means overtime opportunities. So you have a lot of people working multiple days in a row.
Sometimes the overtime is mandatory to keep fire stations staffed. And some other jurisdictions across the metro, stations have had to shut down temporarily due to staffing. Chip Ports is the Mid-America Regional Council Emergency Service Chair. He says the increase in calls for service isn't only people sick with COVID.
People were waiting too long to go to the hospital in 2020, and now those uncomplicated circumstances are becoming more complicated because they weren't getting the care they need or they weren't seeing their primary physician.
As emergency rooms fill up, ambulances are having to drive patients further away to find them a bed.
If we're out of district and an emergency call comes in and all of our ambulances are busy or trying to find a hospital to drop a patient, then we call mutual aid. That district, maybe a little bit further out, sends an ambulance, which leaves their jurisdiction unmanned for a while. And this, it's kind of a cascade, a big ripple effect.
Officials don't want to discourage anyone who's having a real emergency from calling 911 or getting an ambulance, but they say if you just need a COVID-19 test or are having mild symptoms, that's better to be taken care of at your primary care doctor or in urgent care. Leslie Aguilar, KCTV5 News.